So thank you for inviting me. And as a scientist, I have to say, I believe that actually there's an opportunity for every challenge. So although we're talking about challenges, I think that's they're opportunities. Anyone who knows me will actually know that I have a great passion for 7-day services, not just because I believe it's the moral thing to do and the right thing to do, but actually partly as a result of something that happened to me about 6 or 7 years ago because there were no 7-day services available at that time. I left home one Sunday morning expecting to return later that afternoon, but in fact it was actually 6 weeks later before I actually returned home. Because following a serious accident that day, I was confined to a hospital bed for 6 weeks, as opposed to the 2 or 3 days I might have spent in hospital if the services I'd needed on a Sunday were available. But actually, I'm lucky. I actually came through that, but I know that 6 weeks as an inpatient would have been very expensive for the NHS. So my plan this morning is to talk about healthcare scientists, who we are and what we do and how we fit into the system. So my focus is about diagnostic rather than scientific diagnostic services rather than imaging services. I thought we could have a look at some of the examples of 7-day services that are working at the moment and explore those challenges and opportunities. And I'd also like to share with you some exciting innovations that will enable delivery of 7-day services, as well as having a think about what alternative delivery locations there might be for scientific diagnostics. And if there are commissioners in the audience, perhaps we can touch a little bit about how we can support intelligent commissioning of services, as well as exploring the workforce and the workforce challenges. So healthcare scientists, who are we and what do we do? So you may not be terribly familiar with us, but there's about 55,000 of us working over 52 specialisms, and we actually represent about 6% of the workforce. So we're carrying out diagnostics from monitoring and from therapeutic interventions to rehabilitation equipment and to patient safety and equipment safety. And we deliver across most elements of care and are responsible for 80% of all the diagnoses that happen. And we're involved in the delivery of 1 billion tests a year. And those billion tests cost about £8 billion, which is about 10% of the NHS budget. So it's a big area of expenditure. And we know that diagnostic requests have doubled in the last 5 years. So this is just an example of who we are and where we sit. So we've got 3 main divisions. So life sciences, which include things like hematology, microbiology, physiological sciences such as audiology, cardiac physiology, and then the division of physical sciences and biomedical engineering, which you might not be so familiar with, but include things like medical electronics, nuclear medicine, and radiation protection. And then recently we've had a 4th division of bioinformatics, which includes genomics and clinical bioinformatics. And so diagnostics really are at the heart of patient care. So there's very few diagnoses of cancer made without pathology input. Vascular services are involved with stroke patients, and you can see long-term condition management of diabetes. And our cardiac scientists support cardiovascular sciences, which we know are so critical. And sort of an example of a care pathway, so from prevention and screening, the diagnosis to treatment to ongoing monitoring and management, right through to end-of-life care, the scientists will be there behind the scenes. And here we have some examples of case studies of scientific 7-day services that were published by NHS Improvement about 18 months ago. So looking at assessment and treatment of TIA by a multidisciplinary team with healthcare scientists providing Doppler ultrasound on Saturday and Sunday mornings. So investigation of high-risk patients may result in an 80% reduction of the people who go on to have a full stroke. So you can see offering that service really improves patient outcomes. Treatment of infertility patients. Well, you might say, well, that's not an urgent and emergency care, that's an elective service. But working in that service myself, I know that waiting another month for a patient is a real quality issue. And I have to put my hand up and say, I actually participate in that 7-day service. And so 1 in 4 weekends I'm there myself. And I can actually testify that seeing a patient on a weekend, it certainly feels that you have much more time, much more quality time with a patient delivering that service. We know that microbiology services offered over 24/7 actually help reduce infection and MRSA rates. And there's an example in the NHS Improvement book about collaborative cardiology diagnostics and how trusts have collaborated to provide that service over 7 days. Celia's talked about the clinical standards, and clinical standard 5 is the diagnostic standard, which indicates how long patients should wait for those diagnostic tests. And so what's the vision for diagnostics? So for me, it's about right time, right place diagnostics. So delivering high quality, cost-effective diagnostics across primary and secondary care. And they should be value for money. And we should be looking at how we can use diagnostics for admission prevention, how we can make diagnostics accessible and equity of access for all. And also reduction of duplication. We know that a patient goes to the GP, a test is requested, but then if they go into secondary care, that request is often repeated, and that may not be necessary. So it's about access of information as well for commissioners. How can we ensure that commissioners have the right information there? And I've mentioned already emergency versus elective diagnostics, and the focus is on urgent and emergency care. But for some diagnostics, it might be more effective to actually offer those services, deliver those services over 7 days. For example, the pathology department that has the big £500,000 piece of kit, it might be more effective to run that over 7 days. And then also, again, the impact of the Monday morning backlog. If the kit is running over 7 days, then you don't get that. Commissioning of diagnostics is often tied into block contracts, and so that often makes it quite difficult to actually innovate and change things. Some of these disciplines, as you've seen, 52 plus, have very small workforces. So you can imagine there's a challenge there, particularly if you've got a workforce of 4 trying to deliver a service over 7 days. And what about point of care testing and diagnostics in primary care? Should we be looking at delivering more diagnostics out in the community? And patient input, what do patients want? Last year, NHS IQ carried out a survey for us of healthcare science diagnostic services, and actually very few of those services had patient involvement asking what patients wanted. And the Atlas of Diagnostics, you've probably seen the Atlas of Variation of Diagnostics. There's a series of atlases, but this one about diagnostics actually indicates where tests are actually performed at different rates. So the darker blue areas are the areas where tests are performed at a higher rate than the lighter areas. And that might be right for the demographics and for the population. But actually, it's something that you might want to think about looking at for your own area. So, for example, their sleep studies, there's a 23-fold difference across the country there. And quality and safety and assurance of scientific services. We know that Bruce Keogh and Ian Barnes had a look at systemic issues in pathology, and the Pathology Quality Assurance Review has been produced. Scientific services are leading the way with accreditation for such as physiological services, the IQIPS accreditation scheme, and the new medical engineering and physical sciences scheme. And we know that CQC hospital inspections will be informed by accreditation. And nationally, the CSO work programme includes quality and safety, so ensuring that scientific and diagnostic services are accredited, and actually that commissioners have the right information to actually commission the services needed. And healthcare science driving innovation, it's actually what scientists are good at, thinking differently. And so we know that some of these challenges will be critical for the future. Simon Stevens has indicated that he expects the genomic revolution to have a massive impact on the delivery of healthcare. And I think these including genomics and some of these other things, are the things that will make a huge change and have an impact on 7-day service delivery. So what about transforming care through genomics and genetics? So the traditional route for diagnosing infection was that a patient would go to the GP, sample collected, sent to the lab, results reported, and test results and treatment would be about 10 days later. But using rapid molecular testing for infectious diseases, we can actually carry out that processing and get a result within an hour. So that really is diagnosis by the bedside, and these are the things that will be transforming our patient care. And just looking at some of the innovations that scientists have undertaken that will actually enable 7-day services. So this is a really good example of point-of-care testing. So Professor Adrian Davis developed a simple, effective device for triage of patients with hearing loss, actually in GP surgeries. And that resulted in time saving of clinical hours and more appropriate patient referrals to secondary care. Professor Malcolm Sperrin and his team at the Royal Berkshire Hospital have worked with Microsoft to tailor the use of an Xbox games console for rehabilitation of stroke patients. And Professor Sian Ellard has been working with MODY, so maturity onset diabetes of the young, which is a rare inherited form of diabetes caused by a mutation in a single gene, and it's different from both type 1 and type 2 diabetes. And Sian and her team discovered that some patients with MODY did not respond to insulin and required alternative drug therapies. And actually they produced a video which demonstrates the change in patients if they actually receive the right treatment, but they have to have the right diagnosis first. And Professor Nick Stone's been working on optical fingerprint of cancer cells and developing diagnostic tests for hard-to-treat cancers. And we've got Becky, who's been working on developing a device for the measurement of continuous bladder pressure, which resulted in a less invasive procedure for patients. So I think you'll agree there's some really exciting developments in the pipeline for diagnostic service that will assist not only in earlier diagnosis and prevention of disease, but they'll support the implementation of 7-day services. And I think this leads us on to commissioning opportunities. So innovation will lead to opportunities for both providers and commissioners. And we need to consider the effectiveness and value for money of these new diagnostics and consider how these might be able to be commissioned. Because we know, as Celia's already said, some of the commissioning levers will include provision of 7-day services in local contracts. And so we need to be thinking about which of those diagnostics we need to include actually in our services. And what about the workforce? Well, we're going to hear about the workforce later. But I think we just need to remember that if we are commissioning new pathways and new diagnostics, then perhaps we need to be looking at how we manage that and maybe decommissioning some of the diagnostics that we no longer need, but understanding the impact and potential risks of perhaps destabilising the system. And accommodating effective 7-day services will mean changes for the workforce. So looking at flexible ways of working, bearing in mind the new technologies we're going to use. So thinking about multidisciplinary, multi-skilled workforce, just as pathology do in order to work over a 7-day rota. And it means staff may need to access different training and education packages to provide them with the skills they need. And also looking about where those diagnostics might be located. So we should be looking at collaborative or partnership working, and that might mean working across trusts or even across different regions to provide the services we need for our patients. And by pooling our resources and expertise, we can use our clinical skills more efficiently and effectively. So we don't have to face the whole thing at once. It's about taking small steps. And as I said, perhaps identifying those diagnostics which have a greater impact on patient outcomes. And as has already been mentioned, NHS IQ are here, and looking at the self-assessment tool, and perhaps doing a gap analysis on which diagnostic services your trust is offering. And here we have an example of we've got scientific leads across each of the old 10 SHA regions. So these are people that might be able to help you actually look at what diagnostic services are available. And they've also got scientific contacts within each acute trust, and they meet on a monthly basis with the CSO. And so, if you need any help, please contact them. And then there's Professor Sue Hill, the Chief Scientific Officer, and myself there. If there's anything we can help with regarding diagnostic services, please contact us. So thank you.